Hi, Commissioners. I'm Dan Mayer. I've been a nurse in the emergency department for 28 years at SF General. My colleagues and I are here today because we're scared. I'm here today to tell you that we don't have enough nurses, nursing assistants, or clerks to safely and humanely care for our patients in our emergency department. I'm here today because I'm scared. I'm scared that the city's Level 1 Trauma Center has been unable to fill vacancies, and we're now down 23 registered nurse positions in that department. I'm even more scared to realize that even if we filled all of those, we will remain understaffed because we are not budgeted for the number of registered nurses we actually need to provide decent care. This is not a good position to be in as we enter the ACA era. I'm scared that there's no firm acknowledgement of or budget for our actual staffing needs. I'm scared that over at room 200, in the midst of an unprecedented economic boom, the party line remains tight-fisted when it comes to staffing for SF General. The emergency department nurses have been sounding the alarm for 2 years now. We've written 2 letters. We recently wrote a 3rd letter. We speak up at staff meetings. We have filled out patient safety forms, and nothing gets any better. I'm scared. I'm scared when an investigation reveals that a coach keeping a patient under constant observation is pulled to do something else and the patient disappears. But we have no staffing issue that is linked to patient safety. I'm scared. A psychiatric patient spends hours in the busy ER waiting and waiting for medical clearance. He finally comes unglued and attacks another patient. But we don't have a staffing issue that's related to patient safety. I'm scared. 2 years ago, we received a decisively worded memo that made a lot of sense. It said, all patients either on or awaiting a 5150 assessment will be provided constant observation. They will have a sitter. They will never be left unattended. But those sitters were never budgeted for, and those patients are almost always left unattended to this day. But we don't have a staffing issue that's related to patient safety. In addition to being, 32 seconds, in addition to being unfair, I'm going to speed up, in addition to being unfair and dangerous to our patients, this can't be an efficient way to run a hospital. Consider that our bare bones nursing staff struggles to do clerical work, MEA work, to keep up with patients' activities of daily living. People, even though it's an ER, they still need to walk, they still need to eat, they still need to defecate and urinate. This all takes time to help, and we have very little help with that. So what happens? We fall behind, we go on divert. The ambulances take our patients to other hospitals, which I understand costs us about $1.5 million, I'm almost done, $1.5 million a month. Then we bring repatriated patients back, which then have priority over our admitted patients in the ER waiting for beds. They still back us up. We go back on divert again, and it's a vicious circle.
Thank you very much.